All right. Good evening, everyone. Thank you so much for jumping in and attending tonight's event. We've got a full house tonight. We've got an outstanding presentation. It's called The Power of Eyes, and it is featuring Dr. Bryan Brandon. He's going to be going through some great information as it relates to eye procedures, eye concerns that patients commonly speak with him about. And we're going to jump right in here. So to start off, again, I want to make sure everyone is aware of the functions that are available to you throughout the meeting. We do have a chat feature that is available within your window there. If you click on the link, you'll be able to type in questions. If you're having any problem with audio, any problem with the video, if for some reason I switch out of this thing and you see the wrong thing and it's showing my dog, barking outside, then that's something to tell us about. But no, we're looking forward to having a great meeting here. In addition, we do have a free gift, as everyone may know. We have a free gift that is going to be provided to all of you during the presentation, and at the end of the presentation, we will be posting inside the chat box a link to a URL where you just click that link. You'll go into fill out your information, and then you will be sent that free gift via email. So please be sure that you take that step so that you can capture your free gift. And let's jump into it here. So first off, I wanted to recognize briefly how happy I personally am that there is now being a relaxing of the mask mandates in the state of California. It's a great issue, and I know it is slightly polarized around there, but in most areas, our kids are back to school without masks. We don't have to have them indoors. And I think we can all agree that moving forward with some better sense of normalcy is better for everyone. So great to have that. Now, COVID, unfortunately, has left its mark. I know it did on me, and I'm sure everyone has heard of this thing called a quarantine 15. That is the lovely case where we gained 15 pounds during that quarantine. And so I know myself, and I received that lovely gift from the quarantine. And, unfortunately, a lot of people were out there buying toilet paper, which let's not even get into how crazy that is. But I found myself, unfortunately, eating everything in sight. And so it was one of those things where a gift that I did not exactly enjoy from the quarantine. And so it's totally counterintuitive. You think that when you can't get food, you ration it, but somehow I didn't quite catch on to that one. One of the things that I wanted to share with you that I found as I was looking into quarantine 15, and this case that actually is quite common across the globe, as it turns out. And this stat actually made me feel kind of good. So check it out. 42% of people actually gained weight. So I'm not too much outside of average, but where I was outside of average, the average weight gain was actually 29 pounds. So I came in below average. That made me really happy. So I wanted to start off, I just share this lovely piece of information with you. So hopefully that makes some of us out there feel good. Maybe not, maybe does. But in addition, one of the things, and this is really in relation to tonight's meeting, we've been wearing masks for a long time. And so when we look at the wearing of masks and the impact that it actually has, this is kind of what I found to be kind of a funny quote that was in a study that was that wearing masks strongly confuses people's representation of emotions. So right? Wearing a mask, you can't see what a person is thinking, what a person is feeling, because we convey so many emotions through our facial expressions. And so when we look at this, there's both good as well as bad that is conveyed. When I'm snarling at somebody, they can't always see that with my mask on, that's a good thing in some circumstances. But in many cases, it's a circumstance where we can't tell what a person is thinking, is feeling when they're talking. And so what we see that occurring during this is that you'll notice the one area is just the eyes. That's the only thing that can actually convey an emotion. And even that gets very confusing. And so when we want to try to express ourselves with a mask, what we end up doing is over-expressing our emotions And how that comes out, because we have to express it through our eyes, is because the eyes are where those emotions come through. And so that overexpression becomes a situation where we have to have this big smile on our face at all times. And you'll notice in this picture here, you'll see that she's squinting around her eyes. And this squinting is how we end up conveying what is the most common emotion, and that's being pleased with something. And it's not a matter of just being happy or smiling. It's a matter of being pleased. Oh, thank you very much. And when you want to smile and show your appreciation for something, you have to squint. And so that is one of the reasons why what we see as the power of eyes and the importance of that now is really coming to light as people start taking their masks off. It becomes a situation where these wrinkles are seen all over. And so we actually call these the COVID creases. And the COVID creases are what we are seeing patients come in with. And it goes throughout all of their eyes. You'll see that in this photograph, you'll see this is actually stretching not only just around the crow's feet, but to the under eye, the bags under the eyes, as well as in the lower face region. And so Dr. Brandon is going to be talking through a lot of different details about what it is that occurs from this and how it is that he can help to correct those issues. So before we jump into that, I want to give you a brief overview of this organization, about FAC. So FAC has been in Orange County for 40 years. We are actually a UCI surgeon fellowship training facility through the American Academy of Facial Plastic and Reconstructive Surgery. And we've been voted the best of Orange County for 13 years. We have a big group of providers. This is all of our providers in the organization. So Dr. Richard Gangas, Dr. Bryan Brandon, our dermatologic specialists who handle a lot of our non-surgical procedures, some of which will be discussed today, as well as our medical estheticians. So these individuals are practicing throughout all of our offices. We have 3 offices. Those 3 offices are San Clemente, Aliso Viejo, and Rancho Santa Margarita. And for those who have not yet had the opportunity to experience it, we also have a HHC accredited surgery center just adjacent our San Clemente facility. In addition, there's also an overnight room that we use for our patients as well, and is available for overnight care post-surgical. We offer a comprehensive array of aesthetic services, both facial plastic surgery as well as non-surgical aesthetics. We've got a very unique approach in that we focus on minimally invasive procedures that will produce the best possible results. And that has to do with both surgical as well as aesthetics, having a natural appearance that produces a fantastic outcome. So these are some of the examples of what it is that we offer here. In addition, we do offer skincare services. So those lovely estheticians that I showed you a moment ago, they provide a wide variety of different services, from facials to Diamond Glow, which is a microdermabrasion infusion service that we recently added, as well as microneedling and microblading. So the star of tonight's show, Dr. Bryan Brandon. Dr. Brandon is a facial plastic surgeon. So he is a local man. He went to school in San Luis Obispo. He also did his doctorate at UCI. So he knows this area well and has been here for a long time. Decided to leave for a little while to North Carolina, but then came back to us here in Southern Orange County. Dr. Brandon, again, is a facial plastic surgeon. He is a board certified surgeon, and he practices exclusively in faces. And that's one thing that is very different and something of note as it relates to plastic surgeons in general. When you have a specialization in facial plastics, it allows you to be very focused in your training, in your experience, and provide oftentimes a better outcome than individuals who broadly focus in plastic surgery in general. So I'm very pleased to introduce Dr. Bryan Brandon. And on that note, I will pass it on over to him. Thank you so much for joining. Let me work through this presenter situation here. Sorry, Dr. Brandon, I'm trying to find where you're at here. Oh, there's the attendee list. Gotcha. Do you have the option to share your screen, actually? There you go. All right, guys, we are working through our Zoom meeting here, and we'll have it for you in just one moment.
Well, I'll have to go through our slides. All right, can everyone see me? Chris, you may want to
see your screen though.
Oh, really? Host disabled, participant screen sharing.
Oh, that's yeah. Just I reset the option for you. It should be good.
There we go.
All right, guys. Thanks for your patience. We're almost there. A couple clicks away. Beautiful. Look, we got it.
And then you may want to mute yours, Chris. Oh, I don't want to go from the beginning. Okay, well, I'll have to forward through it. All right, 2 years into this pandemic and we're still trying to figure out Zoom. All right, can everybody hear me? Sounds like it. So thanks so much for spending your evening here to hear me talk about this. And I'll try to move quickly so I don't bore you through some of the sciencey part of everything, but we'll open up things for questions at the end. And please, questions you can type into the chat and we'll kind of answer them as we go. So first thing I wanted to go over is just our philosophy here at FAC. And, you know, we really believe in natural results. We're not looking to change who you are. We're really trying to enhance your features that you have naturally. And in that tone, you know, we believe in promoting harmony and balance within your facial features. And I personally believe that there's no shortcuts to quality. You have to do the right thing, and take the time and take care of people as if you would take care of your own friends and own family. So I really strongly believe in those principles. And in order to start talking about the eyes, I do need to talk a little bit about the aging process in general, and I'll talk about it in a global sense with how it causes the face to age, and then we'll sort of hone in on the eyes themselves. You know, there are really three main components to facial aging. You have the textural changes on the skin itself, volume loss. You actually lose volume in the face in multiple different areas, including bone and fat. And then, of course, as we all know, there are gravitational changes. Gravity is unrelenting, and it is one of those only sure things in life. It will continue to pull everything downwards, and it has a big effect on how your face ages. And, you know, there are many different components and things that contribute to aging, and that can be genetics, sun exposure, diet, alcohol consumption, smoking, and just stress. So in all facets of aging manifest through this, but as you can guess, not everyone has the same types of aging because everyone leads a different life. So we can't address all facets of aging the same in every single patient or with one procedure. So there's definitely a completely customizable approach that we take to addressing your concerns. Now, with that said, we do believe that the best outcomes that can be achieved are when the patient's needs are addressed and are appropriate for their individual aging. And what I mean by that is not everyone needs the same exact procedure. Some people may need their upper eyelids addressed. Some people may need their lower eyelids addressed, or some people may need both. And those are things that we will discuss. And then we also will not just address only the eyes. Very frequently, we will look at the whole face in order to make sure that if we were to do something with the eyes, it would still look in balance and in harmony with the rest of the face. And so that's why we believe, comprehensive rejuvenation is very important. Now, with that said, it's very important that you understand your aesthetic options. And what I mean by that is sometimes if you only address one thing, say the lower eyelids, or maybe say the jawline, and you don't address the neck, that can look unnatural. Now, fortunately, with eyelids, you can frequently address just the eyelids, and that will not throw out the balance and harmony of the rest of your face. So that is good. And that's something that we would talk about when you come in for your consultation. We will discuss what your main areas of concern are, and if we can fix just that area, or do we have to consider other areas? And I'll get into more of that as we go through the talk. So here's a little bit more on the aging process. So this photo actually shows a mother and daughter half face. So this is the daughter's face, her side, and then her mother. And so you can see a lot of components of the aging process through this, with the assumption that the daughter is going to age at least somewhat similarly to her mother. And so you can see how she has a very nice upper eyelid here with a high crease. And then in her mother, she has lost that crease here. Her lower eyelid is smooth, and there's a smooth transition to her cheek. She has a small, what we call nasolabial fold here, but that's normal. Whereas her mother, it's much deeper, as you can see how this has dropped due to gravitational changes. And then jowls have formed here, whereas she has a nice crisp jawline. So all these things are happening in tandem, and all these things are an interplay between bone loss, fat pad descent or herniation, loss of skin elasticity, loss of collagen, and even a little bit of dyspigmentation of skin. As you can see, her skin tone is much more even and smooth. And then with age and sun exposure, you start to have sunspots, age spots, those sorts of things appear. So what makes a beautiful eye? I touched on it in the prior slide, but we'll go into it a little more detail here. So again, it's having a distinct, and we're talking about more of a non-Asian or a Caucasian upper eyelid, where obviously an Asian eyelid, they don't have a distinct, what we call a supratarsal crease here. And by what I mean by that is the crease that you have in your upper eyelid that then gives you a distinct upper eyelid here. You have a smooth lower eyelid that is actually short in height, going from here to here, and a smooth transition down to the cheek. The outside of the eye is actually a little bit higher than the inside of the eye. And I'll show you a few other examples here. Again, similar. Got a nice clean upper crease that makeup can be applied to. And then a full upper eyelid here in this region is actually very youthful too. And people will tend to lose the volume in this area. You'll lose volume in this area too, so your eyes can start looking hollow. And again, a third example. Now the next slide shows the importance of the eyebrow with the appearance of an attractive eyelid. And so the eyebrows generally start in a line that goes directly north of the outside of your nostril here, and ends usually in a tangent that goes this way, with the arch and the peak of the eyebrow landing usually around the outside of the eye itself. Now that has varied as more so than other components of the aesthetics of the eye through the decades, and you can usually pick out, which decade people kind of ascribe to with how they like to do their eyebrows. So what are some common concerns? So a lot of people have concerns about puffy eyelids. Now this person actually has what's called a kind of an overactive blinking muscle, that orbicularis, causes this bunching here. It's a little different than the dark circles or the bags that you see here. That's actually fat that used to live inside of the eye socket, and due to volume loss and gravity changes to the face, and sometimes it's congenital, meaning people are born with it. It's familial, you know, maybe everyone in your family has this issue. It's because fat is actually pooching forward. And I'll show you on another slide how exactly that works. And then excess skin of the upper eyelid or hooding. You can see in this lady how her eyelid skin is actually resting on her eyelashes. This you see in more commonly in younger patients. So it's just prominence of what we call a tear trough, and it's just this hollow area here. And that can be treated very nicely with filler or PRP. We'll go into those treatments in just a little bit. And then of course, wrinkles. And we'll go into treatments for that as well. So we will start with wrinkles. And to understand where they come from or why, it's actually generally around the eyes, formed from the movement of muscles. So as you smile, raise your eyebrows, or give your angry face, those muscles are contracting and causing lines to form. You do that many, many times over the length of your life, and those lines will actually become worn into the skin. You actually wear out the little layer of fat that kind of buffers the skin and causes the line to form at rest. The best treatment for these in general would be Botox and fillers. Botox is still king when it comes to smoothing out the lines and wrinkles of the upper half of the face. And for a good reason, it works very, very well. So it's commonly used for frown lines, crow's feet, or the horizontal lines of the forehead. Filler, we'll go into some of the applications of filler in just a little bit. So here's some examples of Botox placed in the upper forehead, can smooth it out very nicely. Placed in between the eyebrows, again, can prevent the dreaded 11s from coming through. Here are some more examples. And then the crow's feet. So you can see these lines coming out radially from the eye itself. That's that blinking muscle, again, contracting and pulling everything down. So when you Botox these areas, it will smooth them out. And you can actually notice that in this patient, I would say she got definitely a above average result, but you can see that she got a brow lift out of this Botox, as well as an improvement in her upper eyelid. Dark circles, very common complaint that we hear about. There are many, many causes for this. It can be a little hard to know exactly what is the cause and the best treatment for it, because there's so many different reasons for it. So the skin of your lower eyelid and your upper eyelid is the thinnest skin in the body. So to the point where it's actually almost translucent, so that you can actually see the tissue deep to the skin shining through the skin. What's immediately deep to the skin in the lower eyelid? It's the blinking muscle. So very commonly, you can actually see the purplish, reddish, darkish color hue of the muscle illuminating through the skin of the lower eyelid. Some people actually have true pigment in the skin itself that could respond to lightening creams and PRP and a couple other treatments. Then you also have shadow formation. So from overhead lighting, as you can see, can cause a dark circle to form because of contour changes underneath the eyelid. And of course, things like swelling can contribute to it as well. So here's an example where a small amount of filler can be placed right in this region and improve the shadowing and the contour that you're getting when people have a hollow that's forming there. So you can see how it improved that. Now she still has some textural irregularity here, some crepey skin is how we call it, and that could be treated with something like a laser treatment. Another treatment here, again, hollow and then smoothed out. Subtle in the photos, but tends to be much more noticeable in a good way in person. Now this patient really wanted to avoid any sort of surgical treatment, although I would say that she's a better candidate for surgery because once you have this bag starting to show here, and it's something that you see better in person than in the photos, you become not as good a candidate for filler. But we went ahead with filler anyway and got a really nice result, a really nice smoothing of her lower eyelid there. And, you know, the common complaint that I hear is that people say, you know, I just look tired. I don't feel tired, but people ask me all the time, you know, why do you look so tired? I got a good night's rest. And so it's really, truly an anatomical thing. It has nothing to do with how tired you are, really, although that can make things worse, absolutely. So I wanted to describe a little bit about what I've been talking about as far as how this happens. So you have a fat pad in your cheek, that's right here, that you can kind of squeeze, and gravity pulls it down over time, but it also shrinks as you get older too. So you're losing volume and the gravity is pulling it down. And what that creates is a separation between the fat pads in the upper eyelid and in the cheek. That is what you start seeing when you have bags here, because you're actually seeing the rim of your eye socket start to show through because you're losing the cushion of the fat that used to hide it, essentially. Now, there can be other, other things going on here, so it's not always a fat pad issue, and that's why it's so important to we can't always fully assess these things online or through video conferencing. And that's the importance of in-person consultation because sometimes it can be a skin excess issue or it can be muscle laxity issue. Most commonly, it's due to this fat pad issue that I just described, however. Here's a nice result for a lady that underwent a lower eyelid blepharoplasty, which is a surgical procedure to help improve the hollowing in the bags. And you can see the significant improvement in the softening of the transition between the eyelid and the cheek, just smooths everything out. Another example of a gentleman with the same issue. Now, of course, he had much more significant bags. So this is quite literally the fat pad of the eyelid that is kind of pooching forward. This has been recontoured and smoothed out so that you don't notice it. And this is how we actually do it. Now, we make a small incision on the inside of the eyelid, and we find that fat pad, and we actually drape it over the rim of your eye socket. This is the rim of your eye socket here. And that provides that cushion that I was talking about again, and does a really nice job in smoothing that those bags out. Here's some side views. Sometimes the side views actually show it better because you can see the kind of the pooch here and then the loss of volume here. After the lower eyelid blepharoplasty, she has less volume here, more volume here, and just an overall smoother appearance. She's gonna look less tired. As you notice, it doesn't really change the shape of the eyelid at all, or the eye. That's not the goal with this at all. It's really just smoothing this transition out. And another one. So she had a pretty significant, so this is real, this correlates right here to the rim of her eye socket. And notice how that's gone now, because that fat we took from an area where it was too much fat, and we tunneled it down to an area where there's not enough fat, and it smooths that whole side out. And last one, I think. Nope, one more. All right, so now we're going to talk about a little bit more about the upper eyelids. And the upper eyelids, really you have to think about it as a functional and an aesthetic unit with the eyebrow. That's why I mentioned the eyebrow before. And dressing just one without the other can lead to less than optimal results. And this is where, talking about looking at the patient as a whole and treating all of the concerns together is where you get the best results. So again, if you were to just treat the upper eyelid, you would be missing that the eyebrow is low too. So without restoring the eyebrow up to where it used to be, you will never get the eyelid to actually look rejuvenated. So sometimes we have to do what's called a brow lift or a temple lift in conjunction with the upper eyelid procedure to get the best result. Before we actually I want to talk a little bit about the surgical options, but I do want to talk about some great non-surgical options that we have as well. And the first being Thermage. So Thermage is a radio frequency device that creates a heating of the tissue that you treat. And that causes a lifting and a tightening of the skin in two different ways. The first is kind of an immediate, almost shrink wrapping effect that you get with the heat itself. And the second phase is with collagen stimulation. So several months after the procedure, your body is producing collagen in the area, and new collagen is almost always a good thing to help lift, tighten, and smooth the skin. So this is a result here that shows pretty much an immediate before and after. You can see the heaviness of the upper eyelid here. And afterwards, look at that, he's actually got an eyelid crease. Now, the downside to Thermage is that it's not a permanent option, so it's not going to last as long as a surgical option. But for someone who's looking to avoid a surgical procedure, it's a great option. The other non-surgical thing that I wanted to highlight is PRF. This is like second generation PRP, which is something that people may have heard about in the past. And so basically both PRP and PRF are similar in that it is utilizing your own blood to provide what we are using to rejuvenate the eyelid. And this tends to work very nicely for pigments underneath the eye. So if your dark circles are not so much a fat herniation problem or a hollowing problem like we've talked about, and it's more of a actual pigment issue, then PRP is a great option. So what the process actually entails, you come in, we draw your blood here, we spin the blood or centrifuge the blood down, and what happens is all the red blood cells go down to the bottom, and we get this nice kind of straw-colored solution up on top, and that is containing a very, very high concentration of platelets and fibrin. The combination of those two, when injected back underneath the skin, will release growth factors, cytokines, all the things that the skin really loves to heal and can rejuvenate the lower eyelid. And so that's kind of a picture of the syringes that we use to actually do the injections with. Now, this is something that you have to do for, we recommend a series, and you can start with a series of 3 to 4, but I've seen it take more like 4 to even 6. So you come in about once every month and a half, and we do the treatment. We numb the lower eyelid with some topical numbing. We spin your blood down, prepare it, and then we inject it underneath the eyelid, and it can make a very nice improvement into that color of dark circles. All right, so now on to eyelid lift, also known as the incredibly hard to spell and pronounce blepharoplasty. So blepharoplasty just means eyelid surgery, and so that can pertain to the upper eyelid or the lower eyelid. We already talked about the lower eyelid. But when we talk about eyelid lift, we're really talking about the upper eyelid, because the lower eyelid, you're never actually really lifting. You're just kind of smoothing out the contours. So the upper eyelid lift is an incision that actually hides completely in the crease of the upper eyelid. Sometimes with the lower eyelid lift, you do have to make an incision along the lower eyelashes. But a lot of times it can be done all internally on the lower eyelids so that you don't have any visible scars. And that's something that we would talk about together. Fortunately, the eyelid skin, because it's such a thin skin, it heals incredibly well. The incisions heal amazingly well. And within a few weeks, they're very hard to find. So here are some photos of upper eyelid lifts. So you can see how this patient had what we call lateral hooding. That's where the skin of the outside of the upper eyelid is sitting on the eyelashes. This can get so bad where it's so heavy that it's actually covering the pupil, which is what you actually use to see light or see. And that's when it can become a functional thing. So this patient is likely not having any visual obstruction, but probably not too much longer and would have had it. But after the upper eyelid lift, you can see how it's nicely restored her upper eyelid crease and her eyelids look nice and rejuvenated. Here's the same patient from the side view, so you can see the improvement in the eyelid crease. And you can see what a nice job this does just by itself. I think an upper eyelid lift is one of the best, honestly, best bangs for your buck as far as easy procedure to do, easy procedure to recover from, and a very high satisfaction rate. Here's another example on a younger patient. And she was fairly asymmetric, a little bit of hooding here, but quite a bit more over here. And then afterwards, you have nice symmetric upper eyelids, and really just goes a long way in rejuvenating her eyes. Now this patient, sorry, I don't have photos with her kind of no makeup before or no makeup afterwards, so it's not quite like comparing apples to apples, but I wanted you to see this one because it does show you the importance of dressing the eyebrow at the same time as the eyelid, because in the before photo, she just looks sort of sad and sullen or maybe even angry because her eyebrows are so heavy that they are completely sitting on top of her eyelids. And if we were to only perform an eyelid surgery on this patient, I don't think she would have gotten much of a result. On this side, you can see that her eyebrow now is lifted slightly, subtly, but then gave us a great rejuvenation of the upper eyelid and really just changes her entire appearance. She looks much brighter, happier, cheerful in this photo. This is another example of how important it is to address the eyebrow with the eyelid. You can see how sort of heavy the eyebrow is here, and then how much lifted. So this patient got a full endoscopic brow lift, which is a little more extensive than the other patient, but again, did a nice job opening up the eyelid. And for one last example on the brow lift, this patient actually didn't have anything done to her eyelid, and this is just 100% a brow lift. Brought the brow up above the rim of the eye socket, and now you can actually see her upper eyelid. Okay, well, that's all I have for you tonight. I want to thank you again for taking the time out of your evening to join us. And in conclusion, I want you to take away from this that we have many options, both non-surgical and surgical, to rejuvenate your eyes. And I think, as you hopefully saw in the many before and after photos, that these options, these procedures, can look absolutely natural and not really change who you are, and just really enhance your eyes. So thank you.
Outstanding. Thank you, Dr. Brandon. Hey, before anybody leaves, please make sure I'm adding right now to that chat box the link that you can use to be able to fill out that post survey. We really appreciate your feedback. It really helps us to be able to provide informational webinars and seminars like this that are really valuable. Hopefully, we're keeping our fingers crossed that our next plan is actually going to be an in-person event. We're really excited for that. But please click on that link. You'll be asked to enter in just some basic information, your name and email address, and then we will send you your free gift for today. At this time, there's also an opportunity to take some questions. So if anybody has any questions, please chuck those into type them into the chat box there, and we'd be happy to answer them. Great job, Dr. Brandon. We had multiple comments about how wonderful those results looked, and so outstanding work, very nicely done. Now that we're finishing up here, it's always been a challenge for us because doing the Zoom things, we don't have an opportunity to see everybody's faces. And so for those of you who did send in your thank yous and your comments throughout this, thank you so much. It really helps us keep going and know that everybody's out there. I wish we could see everybody's faces and open up the mics, but that's how it goes, I guess, these days. But our next event, again, keep an eye out for it because it will be a live event at this point in time. That's what the plan is. If you haven't followed us yet on Facebook and on Instagram, please do so. You'll see about all of the latest information on there. Dr. Bryan Brandon also has his own Instagram handle, so please check that out. We've got a question here. The cost of eyelid surgery. You want to jump on that one, Dr. Brandon?
Yeah, so it really varies, honestly, just about between what eyelid we're talking about, the upper versus the lower, and what we're trying to accomplish. So if that's something that you are interested in learning a little bit more about, just please reach out to us and we can give you some information about that. Sorry, I can't give you an exact answer on it, but it does tend to vary quite a bit just based off of your unique needs.
Yeah, absolutely. And within that survey that you click on the link within the chat box there, there's going to be a question that'll ask if you're interested in meeting with Dr. Brandon. There's also a notes field, so you can feel free to type in those questions and we will be happy to reach out to you to schedule that consultation with Dr. Brandon and be able to answer any additional questions. Obviously, there's a lot of questions that come up after the fact, but that was a great question. Thank you. Here's a question about PRF. Can you tell me a little more about PRF?
Yeah, absolutely. So I stopped sharing my screen. But so the nice thing about PRF, the thing that I like about it is it can be used somewhat as an alternative to filler underneath the eyes. Now I use PRF in all kinds of other things too. So we use it in conjunction with microneedling. So in facials, it can be a great adjunct. We use it in hair restoration as well. It's actually been shown to really improve hair loss and even promote some amount of hair regrowth in patients that are thinning in hair. But as far as it pertains to the lower eyelid, it can be used either as an adjunct, meaning in combination with filler, or for some patients who, for their own personal reasons can't or don't want to have filler. This is an all-natural alternative to it that can still get nice results because it's 100% your own blood. There's no additives, preservatives, or other foreign material. It's really just super concentrated platelets, which contain all the growth factors that your body uses to heal. And it's just placed underneath the skin and does a really nice job, primarily in improving pigment and dark circles, underneath the eyelid. I hope that explains your question a little bit.
Excellent answer. Thank you so much. I'm just looking through to make sure we answered all the questions thus far. And I think that's all the questions we have at this point in time. So again, please make sure you click on that link there. And for all those that are registered, we will be sending out that email shortly after. Actually, it'll be tomorrow morning. It'll be coming out. So thank you for your attendance tonight. We look forward to hearing from you, and have a wonderful evening.
Thank you, everyone.